Kia ora, I'm Dr. Helen Fulcher, and I'm speaking with Leanne Karu, who's a clinical prescribing pharmacist. Today at the Goodfellow Symposium, Leanne is talking about COPD, gout, and Māori health. Welcome, Leanne.
Oh, thank you, Helen. Ata mārie to you too. It's nice to be here.
Now, Leanne, can you talk a little bit about the key things that you want to get across to primary caregivers at the symposium?
Well, I guess we've started off well this morning with our keynote speaker, and in terms of thinking about us all as clinicians and where our part is in terms of health outcomes. So I think that's really important, and it possibly underpins what I'm going to be talking about in the rest of my presentations, and a kind of a common thread, I guess, Helen, around engagement, around really substantive communication, that underpins. I was thinking last night, like you mentioned, one of my topics is gout. Well, I have 672 EndNote references in gout, and historically I've spoken to clinicians ad nauseum around all of those references and worked out numbers needed to treat and given them a very clinical perspective. But this time I'm going to sit them down with my what I call cultural literacy resource and talk people through that. Because I think that's the part that we're really fundamentally missing. And that's our part that the keynote was talking about this morning. That is going to be really increasingly important. It always has been. And also with the COPD presentation, I'm lucky to be alongside Linda Bryant there, who is Dr. Linda Bryant, prescribing pharmacist as well. So again, we're taking that perspective of engagement and thinking about the critical self-reflection, as us as clinicians, how are we delivering interactions that are safe, and safe is defined by the person in front of us, not by us as clinicians, and the information that we're passing over to empower people. Again, it's about that empowerment. We've always said, the population is the untapped resource, and how can we get them around helping their own health outcomes. So I guess that's the underpinning part.
Yeah, absolutely. I think when we've talked before, as I mentioned, you've talked about health literacy is not so much on the patient side, but on the clinician side, that unless we're communicating in a way that our patients understand and feel comfortable, and we're engaging with them in a way that's safe for them, not necessarily us.
Absolutely, well, I wholeheartedly believe that. I take umbrage at people who say that, the population has poor health literacy. No, I maintain that clinicians, we're often very poor at giving over understandable messages. So and I think some of the panel discussion I'll be having this morning with Dougal and Lily will be centred on that, and around how often we kind of launch straight into the who we are as clinicians and what are you here for, and let's speed this up type of thing.
The agenda.
The agenda that we've made and are looking to impose on people.
Yes, I think that that's obviously important. I think in your COPD talk, you're talking about some new medicines that are coming out. So especially in that case where you're trying to introduce a new medicine or new concepts or new regimes to patients, does it become even harder?
Yes, absolutely. And lots of clinicians aren't even really up with the play with the new medicines. So and then how are you presenting that information that you're not so au fait with yourself in a really understandable and culturally safe manner? So yes, that will be another big point. Like I said, it's going to be less about the studies and the mode of action of drugs and numbers needed to treat this sort of thing, as about that engagement empowerment part of the process.
Have you got a few key tips you could pass on to us now before your talks of the skills that we should be trying to learn?
Well, I think we have the term whakawhanaungatanga in Te Ao Māori, and it's not just that kind of rapport type approach. It's about really having a connect and enabling people to feel safe and pass over intimate information. That's a really good place to start, and at the end of the interaction to think about how well you have presented it, so to check for understanding. I mean, it's health literacy 101 if we're wanting to look at health literacy, but we often miss that part too, that check, just to see, again, with the onus on ourselves as clinicians is.
Yeah.
How have we delivered it? How much are people taking away with them?
Yeah. Do you think we're missing that because we're so busy in our consults?
I think that's a huge part of it,
Yeah.
Helen. And again, I seem to be referring back to our keynote, the speaker, but this is really a great opportunity for us to reframe.
Yes.
When I set up my own practices, and general practice, I discussed and negotiated with the DHB that I would never be tied to a 15-minute consult.
Yeah.
I think, yes, we can keep sort of being the kind of reactive approach or patching up and getting people out again, or actually,
Yes.
we can prevent that happening and have some really great relationships as defined by people and working through their priorities.
Yeah.
Not our own agenda. And I think you often can't do that. And I know GPs, and I know I think it's a luxury for me, and it is. But I was initially tied to being told that I would only have 15-minute consults, and I said no. And I think perhaps that's a time for GPs to think about that too. Where is the evidence for 15-minute appointments?
Yeah.
Some GPs may like that, but I don't really believe that you can do everything that you need to do
Effectively.
not effectively.
Oh, kia ora, Leanne. Thank you so much. And I think you've got a lot to offer. I can't wait to hear your talks.
Oh, thank you, Helen. It's always lovely to see you and to chat with you.
Likewise. Thank you.